Hi, up Honors Program. I'm Riley, and I'm back again with Joe Verzwyvelt and Joe Verzwyvelt's mustache.
Well, well, they got to come together. I mean,
So, Joe, can you take me through just kind of what an emergency physician is? What's their main kind of job, I guess?
yeah. So, emergency medicine is kind of it was like the latest specialty to be created. Whenever we first found out that like an emergency room actually made a difference, like it used to be like you were the family doc and you just took call.
Yeah.
It's kind of a punishment like no one really liked it. But then it started going, hey man, we can have doctors that are like just do shift work and like they train in like actually doing emergencies. Maybe this is a good thing for them. And so, they've developed an emergency medicine residency program to develop true emergency physicians. And so, what we are is we kind of, sometimes we get labeled kind of the, jack of all trades.
Master of none.
Well, I would say master of none, but there is, there is some truth to that, I would say. But I mean, you need to know a little bit of everything because you're taking care of, newborns or, freshly newborns and a mom, all the way up to 110-year-olds. You need to know, basic surgery. There's procedures you do that require surgical skill. You need to, have all facets of knowledge. And so your main role is this: you're taking people in to the emergency room, and you are, either treating an acute disease process or you're making a diagnosis based off what they're presenting with. And then also, like as an emergency physician, you're the portal of entry to the healthcare system. And so a lot of people that don't have docs or don't know what to do, they're coming to the emergency room, and then you kind of have to make that decision on, does this person need to come to the hospital or what do you need to do from there?
And get referred to different kind of specialties. And stuff. Yeah, okay. What could you describe like a day in the life, I guess, just from maybe just before a shift to after a shift?
Sure. Yeah, I mean, the nice thing about emergency medicine is that this is shift work. You don't take call. And so you usually know, hey, I've got to come in to work this shift, whether it's a morning shift, afternoon, or an overnight shift. And that kind of will prepare you on how you approach that. But, it's a lot of times, like if I'm working a night shift and I get up and kind of do my normal day thing and then I work overnight, or if it's a morning shift and I have time after my shift to do kind of normal daily stuff after I get off of work. Usually preparing myself, I usually have some good music playing.
There you go.
On my way into work, just kind of getting them in. Lately it's been Ted Nugent's Stranglehold.
Ted Nugent, okay. I'm not very familiar, but
you got to put it in.
Okay, I will.
It's great. It's a great song.
I mean, it sounds kind of familiar right now, but it sounds like any other classic rap song.
You gotta like do this like.
See, if you would have given me like another 2 months notice, I could have maybe had something to say. All I needed was 2 months.
All right, let me go.
Okay. Oh yeah, okay. So just coming out.
Yeah, and then it plays in my mind when I walk in.
It's like you always do kind of have a swagger with you. That's totally what it is.
You don't hear the music, but it's in the head. Or an Immigrant Song by Led Zeppelin's been the other one.
Oh, okay. Okay. So what are some of like the most common procedures that you perform? You said a little bit about procedures, but take me through a couple.
Sure. Yeah, I mean, so what we're going to do a lot is laceration repair, draining abscesses, which whether or not you like that, I find it to be pretty cool. You're going to do a lot of that splinting fractures or reducing fractures. We do a lot of procedural sedation, so kind of putting people, knocking them down, putting them to sleep, and either reducing a shoulder dislocation or splinting a bone back into place. As far as kind of the more advanced, endotracheal intubation would be common. It's so depending on where you work. Since we have a trauma team, we don't do as many chest tubes.
Yeah.
But chest tubes definitely, central lines, arterial lines. It runs the gamut. I mean, you end up. There's procedures that you wouldn't think of, like foreign body removal. Which, depending on the eyes, nose, ears, other orifices.
So this question kind of just came up, but can you talk about the different like positions and the different people that you work with, like in the ED, like just with nurses, EMT techs, that kind of thing?
Yeah. So emergency medicine is one of the unique things in your environment. It's as opposed to a lot of other services or clinics. It's truly a team environment. I mean, what I do is heavily reliant upon everybody else, and everybody else is kind of relying upon me, because as the emergency physician, you may have mid-level providers, whether it's a nurse practitioner or a physician assistant that may be working under you or with you, depending on how your system's set up. And then below that, you'll have nursing. So you have triage nurses that help check in patients and get them ready. Then you have the nurses that help you out. And then you have specially trained nurses like sexual assault nurses that help you out. Then you have social workers, which are really important. I mean, there's a lot of social dynamics you deal with in the emergency room, and psychiatric patients that they help you out with. Child life specialists, and so they'll help. Like the squirming kid with an LP or getting an IV, they can provide entertainment and things to distract them, and they're kind of trained to do that. Okay. Very helpful. Then you've got, depending on your system, you can have either like CNAs or EMTs or paramedics that assist with getting medications, doing vital signs, helping out with your procedures.
What percentage of patients would you say you make a new diagnosis on versus that they're coming in and you're managing their previous diagnosis or previous kind of comorbidities?
Yeah, I mean, that one, it's probably more like won't want to say 50-50, but you're probably managing chronic disease like 60% of the time, and 40% of the time you're making new diagnoses. Okay. Now, the number's a little bit bigger in urgent care, because it's like, you broke your finger, but I mean, like, as far as like in a true emergency department setting, it's probably like 40-60.
Okay. 40 new diagnoses. Okay. Do you have, I guess, maybe a least favorite and a favorite part of emergency physician?
I mean, my favorite part is not knowing what's going to come to the door, not, you don't know what you're going to get. It's a box of chocolates, man. You just open the top and see what's there. Right. Maybe the label's scratched off. Maybe it could be a salted caramel truffle, or it could be a chocolate covered cherry. Or maybe it's something you've never seen before. I don't know. So yeah, you don't know what you're going to get. So it's kind of keeping you interested, and you always got to kind of be up to date on like the newest stuff, because it's like, I'm not a cardiologist, but I got to know what a cardiologist knows, like to stabilize a patient, or who needs to go to the cath lab. I mean, and so you take every specialty, and I got to stay up to date on all aspects of it. So I like the continual knowledge base and the ability to interact with like EMS. As far as what I don't like about it, I mean, sometimes it can just be an emotional drain. People with certain personalities tend to draw towards emergency medicine, but I mean, you see people every day at the worst point of their lives. I mean, either they're super sick, you may be given a new cancer diagnosis, or you may be telling a loved one that they've lost their husband, their child, and so, I mean, that's kind of the part I would say I don't like. It was also a part I enjoy about the job. Because I mean, if you feel like you can comfort somebody at the worst point of their lives, I mean, it's powerful stuff. But it can be emotionally draining on you sometimes. Yeah, for sure. I was kind of surprised you didn't say that charting was your least favorite thing. Well, that's just because you got some really nice. Yeah, because stellar scribe work, so it's like I don't need the chart's already done for me. So.
So actually, with the scribe kind of thing, how did your kind of workflow, or maybe your charting or work outside of work or outside of your shift work, change when you got a scribe? So maybe compare from before to after having scribes on.
Yeah, so scribes helped me tremendously. Well, I don't do charts outside of work, but I never have. I mean, I'm kind of really
just get it done.
Get it done. Yeah, but it helps me like seeing a patient. So instead of me like seeing a patient trying to like either write down or remember the story, I can just focus on the patient. You know, I can do my physical exam, and it's just there's less stress because I'm not worried about running back to my desk and getting everything in. So it gives you a lot more one-on-one face time with the patient, which is the thing that with the way healthcare is, we don't get as much because charting and documenting and worrying about all that is taking up most of our time. But if that's off of you, you know, it gives you more time to think about the patient, more time at bedside with the patient.
Right. Yeah. Takes out the meticulous side of it, I think.
Yeah, and I mean it's a necessary evil, but it really, if you look at what we're doing, if it wasn't for all the outside factors like, you know, lawsuits and things like that, I mean, the documentation isn't. It's what the care you're providing is what the heart of it is, and that gets overlooked a lot of times.
Right. Do you have any words of advice for someone, maybe a high school student or an undergrad, or even someone like me who's going into medical school, about if they're interested in emergency medicine, how to get to that point, I guess?
Sure. Yeah. I mean, I think, you know, the first thing I would say is like if you like, especially if you're going into medical school or you're further along in your college career, you know, if you want to do emergency medicine, I don't know. The way I took it is I tried not to like emergency medicine because when I started medical school, thought that's what I wanted to do. Yeah. So I tried to not like it. And I said, you know what, I really want to try and get into all these specialties. You know, I can learn as much about them as I can. It's like being open-minded. It's, you know, at least at the late college medical school level, it's, you know, I ended up liking a lot of rotations, and that kind of pushed me even further to know that I want to do emergency medicine. So I wasn't sitting in an OR cutting bowel open all day, or, you know, I'm not operating on brains. I'm not sitting in a clinic. I get to kind of do everything. You know, early on in my career, or at least, you know, high school, early college, you know, I think trying to get involvement with, you know, volunteer work. I mean, like you being a volunteer first responder, that's an excellent way to kind of set yourself up to getting a knowledge base and to getting yourself integrated in the system. I was got a pharmacy technician certification my first year of college, and worked in a pharmacy and kind of learned what drugs did and what kind of conditions were treated with this drug, and so that started me off early in that process. So, you know, I think those things are important, getting yourself involved and finding opportunities and then kind of taking the opportunities head on and excelling at them. So
yeah. Can you tell me a little bit about your shirt? What is the Air Medical Physician Association? What is Bless you. I can start over. Can you tell me a little bit about your shirt and the Air Medical Physician Association and what's your involvement in that?
So Air Medical Physician Association is kind of it's an organization which helps support docs that are involved with either they're actively like flying with a medical program or providing direction for an air medical program. So the helicopter EMS service or fixed wing. I've been involved since I was in residency as a flight doc, and I did, you know, I was on some committees in my flight program, and so I've stayed abreast there. And then the conferences that they hold, you know, get a lot of insight, lots of good education that are applicable not only for the air side of EMS but also the ground side of EMS.
Nice. It's a nice purple. It looks good.
Yeah, I love purple. Purple and gold are my not Vikings, but Tigers.
Right.
Yeah, I love shoe colors.